This is Josh with Dream Body Clinic, and we're going to talk about the stem cell knee treatment today. This is the most common treatment that we do here at Dream Body Clinic. Been doing stem cells for almost over 8 years now, helping tons of people, and it seems like everybody's knees go out at some point. Now, the most common things that we see are arthritis, so lack of cartilage, meniscus tears, and ligament tears like the ACL, the MCL, the PCL. As long as it's not a complete tear, we can usually fix it up. We see a lot of patella arthritis, we see inflammation, Baker's cysts, which are a reaction to chronic inflammation. We're able to get rid of those. And I've personally dealt with some of these issues. The first treatment I ever did, and I was patient number one because I don't offer things that I don't do myself, were my knees. And my right knee, when we did the MRI, I had multiple meniscus tears and a partially torn ACL. So we did the injection, very simple, right into the knee. We put 50 million stem cells in there and they start seeking out inflammation. They're gonna find what's wrong. They're smart like that. We don't fully understand how they know that, but there's a big just messaging system going on throughout the body, cells communicating. And that's how these types of cells work. Mesenchymal stem cells work via what's called the paracrine effect. It's the signals they send out that start guiding the repair process. Think of them like the manager on the construction site. They're telling the workers what to do, where to go, and the first thing they do is start getting rid of scar tissue. So anytime you have an injury, the problem is with your body, the older you get, you have fewer and fewer of these mesenchymal stem cells in your body naturally. So white blood cells rush to the area and they can only heal via fibrosis, that's scar tissue. So what happens is they patch it up with this scar tissue, and now the growth factors that are naturally occurring in the plasma in your blood get there. They want to help, they want to heal, but they can't. They can't get past that scar tissue. The mesenchymal stem cells get in there and they start sending workers to start getting rid of that scar tissue. Then they start regenerating that tissue. If it's cartilage, they're going to recruit chondrocytes, which are the building blocks of cartilage, start building that back. So arthritis is the most common thing we treat, and it can be the easiest or the toughest. It depends how long you wait. Most people wait too long, and when they come to us, they're like 3rd or 4th degree arthritis. Well, 4th degree arthritis is what is commonly called bone on bone. You have a lot of people go to like their doctor in the US, Canada, UK, or Europe. They'll do an x-ray and they'll say, oh, you're bone on bone. Now, you don't always want to believe that. An x-ray is not a good way to assess cartilage, actually. You can infer how much cartilage is there by the space between the bones, but the problem is they can angle that x-ray from any way, and they usually only do one shot